There you go.
Good afternoon, Facebook, family, and friends.
Hello.
Hey, our subject tonight is talking about the medical field and the type of atrocities many have played in this arena. I have been having a problem with my hip for the past 4 or 5 years, if not longer. Pain, excruciating pain going up and down my right leg and the lower part of my back. Getting all kind of MRIs, X-rays, wait of time frame, another MRI, X-ray, but nobody telling me nothing. But so being adamant and persistent, praise be to God. Today, this particular doctor, I goes to her. She gets the results from an MRI that I took last month. So she reading it off. She said, "Well, there's nothing wrong with you here. You got some degenerative bone disease, a lot of arthritis, and I see where you have a cyst on your back that could be causing you out. Wait, hold up, doc. You taking me too fast on all this stress. A cyst? Yes, we found this and blah blah this and that. And when the last time you had an MRI? Ma'am, I can't remember. It's been so long. They constantly sending me back and forth to different doctors for tests. So she goes back and pulls up where this particular doctor did an MRI in 2014 about the same pain and problem that I'm complaining about now. She shows me in the record, praise be to God, where the same findings she found out this month, this doctor knew in 2014. But I'm constantly going back and forth to you, and you act like you don't even know what's going on. Your blood pressure is up. You're too big. That's what's causing the You giving me every excuse but the right excuse, and it's in black and white. So I don't understand this, America, do you?
No.
How can someone experiment on someone's health and I'm the patient? Y'all getting paid to see about us, whether Medicaid and Medicare is that much of an insurance or not. It's all most of us have. And if you're not going to take care of us properly and adequately, what good is it you practicing medicine? Because you go to school for this, you get a degree in what you're doing. So.
And taking oath.
So with that being said, I really don't know what to say, and don't act like I'm the only one, America, that this has happened to. Many of you are dealing with medical problems and health issues, running back and forth to the doctor, complaining about the same things and not getting any answers. My ex-husband got sick one night, had been going to regular doctors for quite some time. But he goes to the emergency room, and the emergency room doctors find out he got cancer, and his regular doctors missed that. Then they give him 6 months to a year to live. He died less than a month later.
Same thing happened to my grandmother. She's been going to the doctor for years. Went to the hospital back in maybe November. And they said, it was just, she's got a cough because the air is dry or whatever when it was a drought.
Right.
A month later, maybe not even a whole 30 days later, they had to take her back because she kept having the problem. They told us in the emergency room she has cancer. Then they told us if she didn't take chemo, she was not going to make it to February. She took chemo, and on her second treatment, she was gone. And about a couple of weeks later.
But they told her if she did not take it,
she wouldn't make it to February or the end of February. She took it, knowing that she was in stage 4. It had got to the bones and everything.
My Lord.
Attacked all of her organs. And they literally kept her alive. Because she was gone after that second treatment. It was gone. She was gone. They kept her alive on life support for maybe 2 weeks.
And no offense, America, I know some cancers are hard to find.
Suffering.
But how you going to miss stage 2 and 3, and when you find out, you tell me I'm in stage 4, there's nothing you can do?
Well, how is it if it was so hard to find? Did they find it in the emergency room? Because if it was so hard to find, they would have found it after going through a whole bunch of tests after.
Does that mean that the emergency room doctors are more qualified than the regular physicians? Does it mean that they care more about the patients than our regular physicians? I mean, there are a lot of people battling with health issues, health insurance, America, while everybody's focused on Trump and his trickery and the bullshit he got going on.
The circus.
Circus. We need to be more focused on what's really at hand. Our health, our children's well-being, our state of existence. So, with that being said, are you finished telling America what you want them to know?
It was the same thing with me as far as the tumor. I think I found out, well, I took my MRI. I'm going to say it was 2011, but I'm going to say 2012 just to be on the safe side. I found out in April of 2017 that the problem I was having with my hip and my side and the pains and the, loss of feeling in my leg, that I had a small tumor on my spine that they knew about from
5 years later.
5 years prior, and nobody never took the time. They told me about my messed up disc in my back, but not one time did not one single person tell me that there was a tumor on the bottom of my spine.
Until you say you lost your Medicaid and got private insurance.
And once I got my private insurance, that's when they told me about it.
Well,
I was working a state job, and I picked up the insurance from the state, Blue Cross Blue Shield. And all of a sudden now I got all kinds of clarity going to the same doctor for the same treatment. And they decided to tell me 5 years. So I've had this mass in me for 5 or maybe more years.
Right.
Just invading me, and I know nothing about it. Then just losing a parent pretty much to cancer, not even 3 months prior almost. That just puts you, where's the quality of service?
Where's the trust?
Where is just the common decency and of taking the time to read a patient something as simple as what your findings are? It's like, oh, okay, well, here, take this prescription. All right, thank you, bye-bye.
It's like it's a money-making scheme.
Exactly.
Every time I go in, you want to up my blood pressure medicine. You want to up my insulin medicine. Yes. You want to up everything except information.
And I'm going to tell you something else. Say, for instance, something happened with your life insurance. If you're taking medication, 2 or 3 different medications for the same ailment, that makes you ineligible for automatic coverage for insurance. So are you giving me this medicine because I really need it, or is it just something to do? And then if I'm taking 2 or 3 medicines and I'm taking these medicines, how am I to know that this is accurate when you haven't tried this treatment on me in a medical facility? So if my blood pressure is so low that I could possibly die, you got a team that could help me. You want me to come home in the privacy of my home and take 3 and 4 medicines for the same thing?
And you're not monitoring the medication or what it does for me. And all the different medications, I understand every medication has a different side effect. But with all the medications that y'all got many of us on, how will we know which medication is causing which side effect?
And then how am I going to tell somebody what I had to take if I'm dead? This is something that should be tried in a clinical setting before you send me home.
Me home.
So what if my blood pressure today is not as high as it could be under a stress or something else, and you're saying take this medicine every day?
It's too much, America. And with that, and on that note, we'll come at you again, and it will be the same issues and the same situations, talking about medical conditions in America. Thank you, guys, and have a great day.
Bye-bye.
Bye.
Leave your comments and let us know so we can talk about them.